Not able to. So good morning, everyone. Thank you for joining us this morning. My name is Meghan O'Connell. I'm a family physician and medical epidemiologist. I work for the CDC Foundation and have been assigned to the Great Plains Tribal Leaders Health Board since the fall of 2020, working in the pandemic response and now other activities. So I am a physician by training, so I have my medical degree, but I also have an MPH in epidemiology. And I think we have a wide range of experience and knowledge here. So I know some of you are experts, including some of the people I work with, know a lot more about epidemiology than I do. And some of you maybe don't know anything. So bear with me wherever you are on that spectrum. We're going to try to get everybody on the same page in opening the symposium. So I have no conflict of interest, and much of this presentation was taken from the CDC's Public Health 101 series, which if you do want to learn more, they're online, they're free. You can watch videos of people from the CDC talk about different aspects of public health. So that is available to anybody who's interested. We're going to talk about public health a little bit, epidemiology approaches, and then data, which is really the heart of epidemiology. And I would say of public health. Data is so important in what we do, and including in what we do at the Tribal Epidemiology Center. And so all of what we're going to talk about is really how we get data, how we look at data, and to point out why it's so important to do any sort of public health, not just epidemiology. Oh, I'm sorry, I'm advancing on mine, so I think it's advancing. It's not, of course. 4, please. Slide 4. I'll have to multitask here, I apologize. Slide 4.
Okay.
It should be a waterfall.
There we go.
There we go. All right. So many of you may be aware of the story of the babies falling into the river that we often tell with public health. So that it's an allegory to try to explain how public health practitioners think about public health and how it might be different than, say, clinical medicine or other health sciences. So if you have people falling into the river and they may be coming down the river and falling off this waterfall and you're standing at the bottom, you have a couple of choices. Do you start pulling people out of the river, right? And maybe they can't swim, or maybe there's so many you need to get them out. Maybe we could teach the people to swim, right? After they fall off the waterfall, we could teach them how to swim and they'd be okay. Public health goes, why in the world are people in the water and falling down this waterfall, right? So you take off and there are people there to help the people that need to learn how to swim and pull them out of the water. But if you're a public health practitioner, you want to go see why are people falling in the water and see if you can keep them from falling off the waterfall in the first place. And you may find different things about what is causing them to fall. Maybe there are bridges crossing the river upstream, and some bridges are well built and others aren't. So people are falling off bridges that are poorly built, for example. And maybe you need to work on building those bridges. Maybe there aren't any bridges and people are trying to cross. We're not always sure what we're going to find, but we're going upstream to try to figure out what is causing what we're seeing downstream at the bottom of the waterfall. See if I can make this work. Oh, so public health is very broad. It can include infectious disease problems like COVID, chronic disease like diabetes, even response to emergencies or trying to prevent injuries like motor vehicle accidents, or even environmental health problems or other public health threats. But regardless of the problem, we take kind of the same approach with 4 general steps. First, we want to know what's the problem, right? People are falling in over this waterfall. And we do that by using surveillance to monitor health events. And there's a lot of ways we can do that, but I'm sure some of the things that you'll hear about, they are really about surveillance, trying to look for changes in the health of the public or a community. And once we notice a problem, like we'll use COVID as an example, there's a lot of people getting sick with this weird respiratory disease, right? Way more than we think there should be. then we start to look upstream going, why are all these people getting sick? And what is the cause of the problem? After we start to look at the cause, we try to figure out, can we help this, right? So if we figured out, well, this respiratory illness is caused by a virus, are there things we can do to help slow the spread of the virus and or keep people healthy or make them healthy, right? So do we wear masks? Do we have vaccines? Do we social distance? And once we have those hypotheses about what might help, we have an intervention and we implement it. So how do you do that? How do you make these changes? And although I'm going to focus on epidemiology, public health is much broader. We're not the only part. We work together with a range of other professionals in public health to keep people healthy. So what is epidemiology specifically? It's really about counting and describing, I would say. You want to know, as I said, are people getting more sick or less sick? How is that happening? Describing what's going on with those different people, and then trying to do something about it if we need to, and using science and data to do that. So more specifically, we want to discover what the agent or host of a disease might be, like the coronavirus or a mosquito, if we're talking about malaria, for example, or even environmental factors that affect health. Whether that's, as shown here, pollution, but it could also be your access to healthy foods or your ability to ride your bike around town. Epidemiology is also used to determine the importance of different diseases. We of course don't want anybody to be sick ever, but of course sometimes one disease or condition might take precedence over another just because it's either more severe or it's affecting many, many people. And epidemiology can help you kind of prioritize where you need to use your resources to help the most people. And also, we try to describe the populations at risk. Is it men? Is it women? Is it people of color? Is it old people? Is it children? Is it people that live in a particular community or zip code? With using epidemiology and describing those people who are getting sick, or even describing those people who are healthy, we can learn about characteristics of those groups that might be contributing to making them ill or healthy. And we also use epidemiology to evaluate the effectiveness of different interventions, everything from vaccines to, as I mentioned, walking paths. Do using these in a community or providing these interventions to people actually make a difference in their health? If they don't make a difference, there's really no point in doing it, right? Our whole goal is to make people healthy. And so we've got to be sure that what we're doing works. And if it doesn't, we can use epidemiology to figure out why, hopefully. So again, epidemiology, our goal is to solve health problems on a community level. That of course means impacting individual people, but we try to do interventions that will affect the community. And we do use a 4-step process to do this. We collect data, we make an assessment of the data to try to figure out what's going on, to see if there are changes or anything that needs to be done. Then we make a hypothesis. Again, it's really the scientific method. We make a guess, an educated guess on what's going on and what's causing, to go back to the waterfall example, people to fall off the waterfall, right? We went up there and we looked around and all these bridges had holes in them, and maybe that's why people are falling. And then we take action. So again, maybe we fix the bridges and then we look to see, are people still falling off the waterfall? Are less people? Are more people? Let's hope not, but it could be, we're not sure. And we do this process over and over again. It could be for one disease, one time. It's possible, maybe an outbreak in a specific community. So it's very community specific, but it is often iterative, not just for a community, but for a disease. I mean, again, think about COVID. You know, we've at the epicenter have given lots and lots of information about COVID over the last 2 years, and we're constantly saying, this is what we know right now, there's a lot we don't know, it might change in the future. And that's because of this iterative process that's going on within epidemiology and public health to learn more about COVID, to learn more about the interventions that we're doing, and if they don't work, make course corrections. So we have a specific approach. I've kind of laid it out more broadly, but they really divide epidemiology into two broad categories. So one is experimental and one is observational. I'm not going to focus on experimental, I'm just going to mention it because that's not generally what you do in public health, but you can use similar methods in experimental situations to learn about different public health or medical activities. For example, a COVID vaccine or any vaccine where you have a specific group of people and you do something to them, some of them get the vaccine and some of them don't. And then you see what happens, where you're doing an intervention like that and looking for the outcome. What we do much more often in public health, especially at places like the Epicenter or the State Department of Health, is descriptive and, is observational epidemiology, where we're describing what's going on, and then we're looking again after we change something to the community that to see if the incidence of a disease have changed. So if we focus on the observational portion of epidemiology, we're going back to those questions that you might have learned in elementary school, right? So in descriptive epidemiology, we're asking who, when, where, and using those questions to describe what's happening within a community. And then for analytic epidemiology, we ask the harder questions about how and why, and trying to figure out what explains what we're observing. So again, if we look at COVID vaccines as an example, as I mentioned, in experimental, we would actually have a group of people that didn't get the COVID vaccine and a group that did, and we would give them, and then we would compare what happens. In public health, observational epidemiology, we don't hold back the vaccine from certain people. We offer it to everyone and encourage them to get it. And then ask these questions. When was the population affected? When did different people get the vaccine, for example? And who was infected? In our particular rollout in the United States, right? Healthcare workers and those most at risk got it first. And kids, some kids are still waiting, right? And describing how that process went and describing how COVID might have changed based on the vaccinations. And then we can also look at how they were affected and why they were affected. Again, vaccinations might break down a little bit, but it does help us describe also things like side effects and any negative impacts of vaccines, right? We're constantly monitoring that to see if people are harmed by the vaccines, which of course is extraordinarily rare. They've been found to be very safe. And I had mentioned data at the beginning, and it's at the heart of everything we do. In order to make these descriptions and answer questions about how and why things are occurring within a population, we need to look at descriptive epidemiological data. But I'm doing really bad at my slides and you guys aren't reminding me. That's very rude. So all of you are the people that would like let your friend run around with like lettuce in their teeth. No love.
My bad.
I'm so sorry. I'm trying to keep it all together and you're not helping at all. All these pretty slides I made, totally useless. Maybe we can send them out. Especially that group back there. I thought you were my friend. The back table, watch out for them. All right. Sorry about that. I'm trying to, I did not get a lot of sleep last night, so I really apologize. We got it very late. But the point I really want to make about data before we talk about different ways that we can display it is when we talk about data, in my head, I'm thinking about people. It's not numbers on a page, it's not a graph, it's not something that's really boring, although a lot of people think that. It's actual people, and things that are impacting actual people. And so when you're hearing these talks today, or you're reading a study, or they're talking about public health data in the news, that so many people had COVID, or so many people are in the hospital, it's all about actual people who are sick. And I think that's really important to remember, because it can be easy to forget that people and people who need help are at the heart of all this. But that's why we do epidemiology and public health, is to make people healthier, help them lead more healthy lives, hopefully longer lives. But all those little numbers and graphs are representations of actual people. And so if the only thing that you take from this, I hope, is that that all of this, when we talk about data, and for those of you who don't like data, or maybe don't like math, or you don't like graphs, you don't want to hear about it, just remember that's our way of talking about people, and that we're doing it to try to support. All right. So these graphs are from the epicenter that my colleagues have made over time, just to show some different ways to describe data. And as an epidemiologist, you have to figure out different ways to do that fits different situations. And the reason that we use different descriptions of data is just, it makes it easier to digest. Again, I could give this graph here in a table with lots of numbers. And again, some of my former friends at the back table might be able to pick out the highlights, but most people could pick out what's happening at different points here, even if you don't know exactly what's going on. Like, well, it got big and then it went, something happened, there was a lot and then there wasn't as much. That's much easier to do in a graph like this than if I gave you a table. Similarly, for a different audience, we might use a different way of presenting data. So a graph like the one I showed before might be for a more technical audience, but something like this displays a lot of information in a fairly digestible way, right? Again, you don't need to know much, but I can go, I don't know, something's happening, this bar is a lot bigger than that bar, right? And that might be all you need to know. We might want to know really specifically the differences and right down to the percentages and how they're compared. But the actual message that you need to know might just be tobacco use is reported a lot more, right? And so there's a lot of tips and tricks that you can use as an epidemiologist to try to convey data to different audiences in a way that's digestible. And you can get even more simple, for lack of a better word, but try to convey data for a general public. This is a graphic that was created at the epicenter around COVID to try to explain the risk of getting vaccinated and unvaccinated and getting sick. This is not easy to do. It's actually a lot easier to do that first graph than this. We talk a lot more about things that look like this than making a line graph. But again, we're trying to find a way to convey the information that's been collected about a specific disease, the who, what, when, where, and why, in a really simple graphic so that people can understand. Again, people who maybe don't know anything about epidemiology, a wide range of educations, and that's all part of doing epidemiology. It's trying to figure out how do we tell people about what we've learned in a way that they will understand. Any questions? I feel like I should flip through all my slides again. Sorry about that. But any questions about epidemiology or anything like that? And again, very sorry about that.
Thank you.
Tips for presenting that kind of data to different audiences?
Oh, that's a good question. We have helpers for that. I am not the expert in that. We work with experts at the epicenter. I think, and if anybody has, is an expert in this, feel free. Of course, the first thing is know your audience, right? That's the biggest and potentially hardest part. Who are you trying to reach and why? So even if we look, let's use this COVID as an example. We made special COVID graphics for kids versus adults, right? So it might be people in the same household but at different ages, right? We might make one for, kid, mom and dad, and grandparents, even though they all live together. So it's really important to know who your audience is. And then my other recommendation would be make it accurate. So one of the reasons these are easy to fight about is because it's really hard sometimes to display accurately relative risk, right? If you're this much more likely to get COVID if you're unvaccinated, displaying that in a graphic way and being accurate can be extraordinarily difficult. So that's usually what we spend lots of time doing, is that right? Is that the right way to do that? And are people going to understand that that's what we mean by just taking a quick glance at it? And then I guess my third recommendation would be keep it simple, right? You can have like one message if you're doing it for a broad audience. The more you add, the more confusing it's going to be. People aren't going to read it. I mean, and it almost turns into a marketing campaign, which I am not an advertiser, but trying to have that single message that you want everybody to know, and keeping it as simple as possible. Because I think especially as epidemiologists, we like all the details and all the little things, and you can't even convey that to people, especially some of the general public, at least initially, maybe over time, but you always want to put in more than you really should, right? Keep it as simple as possible and then, get rid of most of it. So you have just like that one thing. I don't know, does anybody else have thoughts about that?
I would just say that one of the things I've worked a lot as a student all the way up through graduate school and now as a professional translating to the community. And one of the things that's overlooked a lot is the health literacy level for general population is 3rd grade. A lot of people don't think about that. And so it's something that you're going to be sending out to the broadly across the community, which should be at the 3rd grade level. And that can be very, very challenging to translate at that level. So I would always keep that in mind.
Yeah, that's a great point. I think too, when you're working in this profession or in this space, you forget what you didn't know when you started. And so it's good to remember that or ask people, because a lot of times things that we take for granted, nobody has any idea. And so it's hard to overcome those blind spots too, I think. I guess my other recommendation is work with experts like that if you can get them. We make lots of materials for the public. It's basically all free and available on our website. So if you want to check it out, you can go look. It's not just COVID, it's lots and lots and lots of other things. I don't make any of it because we have a great team that can make it and do these things because it's a very special skill. I can help figure out if it's accurate or not, and what we want to say and help sift through the data, but I am not good at this. And so find the people that are good at it because it's a very special skill. It's not just, I'll just make a poster. You have to take a lot into account to do it well. Thanks. Other questions or thoughts?